Hello, ladies and gentlemen. Welcome to Triple N Media. I am Dr. Nik Nikam. I'm a cardiologist from Houston, Texas, and today we're going to talk about diabetes and what kind of snacks are suitable for diabetic patients. Not only diabetes, but they also have multiple other problems. So let us jump right into the feature presentation. You can follow my green arrow here on the PowerPoint. Today we're going to be talking about diabetes. What are the best low carb, low fat, low salt snacks? In addition to that, I would also like to add low cost snacks. So let us look at a few options available and then see how you can do your own research to look for items that are particular to your ethnic group so that you will be able to keep your sugar level down and also consider other things like hypertension, heart disease. When you look for low labels like keto friendly, but I'm going to show you, you need to be cautious of the fat content in those which can be higher than in the snacks that are not labeled as keto friendly. So let us look at the first item and then we'll try to cover each one of them. One of the items that is very good for diabetic patients is edamame. These are the dry roasted seeds and they taste good. 1/3 of a cup serving has 130 calories, 0.5 grams of saturated fat. Let's keep that in mind. 150 milligrams of sodium, which is a little bit high, but it's not bad. 1 gram of sugar and 13 grams of protein. This is a very good choice. For one, it has low fat content. Number two, it has minimal carbohydrates and it has a good source of protein and it tastes good. These are some like Sam's or Costco prices, 27 ounce, $12. It is a 0.45 or 45 cents per ounce cost. So that is item number one. Now let's look at the next item, which is Jack Links, which is basically beef. If you eat beef, this is something you may look into. And this also has very low amount of fat, which is 1.5 gram. And it has 6 grams, 10 grams of protein and 6 grams of sugar. It's a little bit more in sugar. But the worst thing is 520 milligrams of salt. This is per ounce. If you eat 2 ounces, you're getting a gram of salt. And with diabetes, if you have high blood pressure, you need to be very cognizant of the fact that can raise your blood pressure. So you don't want your snacks to be doing something that is counterproductive to you just trying to keep your blood sugar level down, whereas you're increasing your salt intake. So this is a red flag as far as salt amount is concerned. Any snack should not have more than maybe max 300 milligrams of salt. So this is almost close to double that. And if you eat more than 1 ounce, which is very likely, if you're on the road and you open up a packet of 100 grams, which is 3 ounces, you may end up finishing the whole thing before you reach your destination. Think about it. And also, this is the most expensive of the snacks I'm going to be talking about. A 16-ounce jar will cost about $16. So if you like this, it is fine. But if you have high blood pressure, I would definitely look at other alternatives. Now let's look at the third option, which is low carb, low sugar, and low cost, and low sodium. What is the problem with the peanuts? Peanuts are very cheap, only 17 cents per ounce. They have excellent source of protein, which is 7 grams. But look at the fat here, 14 grams of fat. So if you are having heart disease and high cholesterol and high triglycerides, this is not something you really want to take on a daily basis. No doubt you are getting a good source of protein, but you are adding twice that amount in fat grams. So I would be a little bit hesitant about this particular product if we are trying to keep your sugar level down, but at the same time trying to keep your cholesterol level down. I know you're saying, man, you're saying one has got too much salt, one has got too much fat, another one has got too much something. So what is the option left? That's a good point. We're going to come to that. Don't be in a rush. Don't be in a rush. Take your time off. And here's another source of protein-rich snack. And this one is protein puffs, which is made out of cheddar cheese. And of course, this one also has 400 milligrams of salt per cup, which is 30 grams. I don't know how serving size is 1 cup 30 grams. 30 grams is just 1 ounce. So there's some mix up with this nutritional table here. But anyway, let's look at other things here. It has got 21 grams of protein, which is excellent, very, very low sugar content, 1 gram, but it has too much salt. So if you are having high blood pressure, this is something you really need to watch, because that if you end up eating 2 ounces, which anybody can eat 2 ounces, and anybody can eat 4 ounces if you're just sitting and chatting with your friends, then you may end up with 1 to 2 grams of salt by overdosing on protein puffs. So that's something I would be very cautious about, what it's going to cost. I think this. Let's move on to the final winner. Of all the snacks that I have covered, I'm sure there are multiple different snacks available in different ethnic stores. So you have to do your own Google research and find out low carb, low fat, protein rich snacks. Then you see which one suits best. Among all the ones I have discussed, I think edamame may be your best choice, because 1/3 of a cup, which is almost like 3 ounces. So you got 130 calories, very low fat, very low sodium, and an excellent source of protein. So ladies and gentlemen, when you are looking for snacks, remember that you not only look at the carbohydrate contents, you need to look at the fat content, you need to look at the protein content, you need to look at the salt content, and of course the cost. Given everything else, edamame is the winner as far as I'm concerned. Even though it costs a little more, at least it's in the long run, it is less harmful if you're having high cholesterol, high blood pressure, and diabetes at the same time. I hope this presentation has been helpful to you. Thank you so much for watching this presentation, and please do subscribe to our YouTube channel, and I will see you in the next video. But before that, I want to tell you that we have a number of topics in diabetes as far as nutrition, diet. So please do watch them, and I will see you in the next video. Thank you so much.